Good morning and welcome. On behalf of the Athens, Georgia chapter of the Links Incorporated, we are delighted and honored that you've joined us today for a conversation surrounding HIV and aging. The Links Incorporated celebrates 75 years as a women's volunteer service organization committed to enriching, sustaining, and ensuring the cultural and economic survival of persons in the communities in which we live. The Athens, Georgia chapter of the Links Incorporated donates more than 2,500 service hours annually. Our members work toward the realization of making the name Links not only a chain of friendship, but also a chain of purposeful service. Funding for all programs of the Athens, Georgia chapter is made possible by generous corporate sponsorships, grants, proceeds from annual fundraisers, and contributions from our chapter members. It is our hope that today's program will not only educate others about HIV awareness, but also to increase the knowledge about HIV and aging and decrease the stigma that surrounds HIV. We're delighted to host this discussion in partnership with the Southern AIDS Coalition as a grantee of the Links Help HIV Education Leadership and Prevention Program funded by the Links Foundation and Gilead Sciences. At this time, I introduce to you the chairperson of the Athens, Georgia chapter Health and Human Services Facet, the dynamic Dr. Diane Dunstan, who will share more information with you about today's forum.
Thank you, Madam President. Again, good morning. I am Diane Dunstan, and I have the honor of serving as the chairperson of the Health and Human Services facet of the Athens, Georgia chapter of the Links Incorporated. I want to thank the chapter and in particular our facet members of the Health and Human Services. So today, the Links established the Health and Human Services facet in response to the chronic health disparities that persist in Black communities and the resultant decreased life expectancy of African Americans and other people of African ancestry. The goal of this facet is to promote and facilitate programs that support the maintenance of good health. We are delighted to serve as the lead facet for the Athens chapter, which has been selected as one of the subrecipients of the Gilead Services Grant awarded to the Links Incorporated Foundation to support HIV awareness in our communities. We are excited today to hear from this distinguished group of phenomenal women as we bring awareness of HIV and aging in our population. This is the first presentation utilizing the grant support for our mission to promote HIV education, leadership, and prevention. We welcome you and invite you to listen, learn, and become even more empowered to maintain good health in yourselves, your families, and our communities. Thank you.
Good morning, everyone. Thank you so much for joining us. My name is Daphne Ward, and I serve as Executive Director of the Southern AIDS Coalition. And we are so honored to be partnering with the Athens chapter of the Links Incorporated for this important conversation for this annual commemoration of HIV and Aging Awareness Day. We have a distinguished panel, and I won't talk much so that we can hear from them, from their expertise, their lived experience, and their own journeys, in hopes that we can raise awareness today around the importance of discussing HIV in the context of aging, particularly when we're talking about the health and wellness of Black women. Anytime we have a conversation at SAC, we really start with a story, because we believe that it's so important to center the experiences of those living with and impacted by HIV. And so we bring into this space so many people who are doing the work on the ground, the many advocates, those who are themselves living with HIV in their communities. And we hold in our hearts those who are living with HIV and don't have a space of support and sharing, in hopes that we can shift the dynamic in the South, particularly, and across this country, to create safe and brave spaces for those who are living with HIV to access care and all the resources you might need. So one story in particular I'd like to lift up this morning is of a woman whose name I won't call, because it could be, she represents so many women, but someone who I met early in this work, in my own work in HIV in Alabama, who was a woman who retired, had an illustrious career, and became ill in her early 60s. She went to her doctor. They couldn't figure out what was wrong with her. She ended up being hospitalized because she was experiencing all types of health challenges with her kidneys, things happening with her heart, her blood pressure fluctuating, and they just couldn't figure out what was going on. And for those weeks that she was hospitalized, no one ever thought to give her an HIV test. It was an assumption that she wouldn't have HIV. She didn't fit the profile. She didn't fit what her providers assumed a person who would have HIV would look like. And when she was eventually diagnosed, she was placed into a nursing facility. And when she arrived at that nursing facility and they learned that she'd had a positive HIV diagnosis and had also been dually diagnosed with AIDS at that time, they put her into a room that was equivalent to a broom closet, isolating her from everyone else in her facility, making her feel like she was coming there to die, and to die alone. And this is the issue that we have when we're talking about HIV and aging, at the intersection of stigma, at the intersection of not having an understanding in our communities of how HIV is spread as a virus, and not understanding what's needed for folks to live and thrive, and the fact that people are living and thriving for decades and decades with this virus. So that is the framework that we really want to operate within. How do we come to a place where people can be supported? How do we create a workforce of medical providers and care providers who understand HIV? And how do we remove stigma at all levels of care and services? So really excited to have this panel of experts here today who are going to share with you their own experiences in hopes that you'll walk away having a stronger understanding of the way that HIV and aging in our communities overlap, and how we can have these conversations in our personal circles and professionally as well. So I'd like to begin by allowing each of you to introduce yourselves. And as you introduce yourself, please also share why you think, or one reason why this conversation around HIV and aging is particularly important. And I'd like to start with Dr. Monica Parker.
Good morning, everybody, and thanks for joining us. I am by training a family physician / geriatric primary care provider. My experience with HIV in older adults came from when I was taking care of several patients on the inpatient unit at Wesley Woods Hospital of Emory University. One of the patients was a longtime patient, kind of family friend, who was the wife of a minister who, similar to Ms. Ward, had been admitted with an anemia. They were saying she had some kind of leukemia. She was really, 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 really ill. And after they did all of the testing, they discovered that this minister's wife, who had been sexually monogamous, had HIV/AIDS. And her cancer, her malignancy, was exacerbated by her HIV infection. Move to patient 2. Patient 2 was a young woman, 35 years old, who had had massive stroke to the point that she was significantly disabled and unable to really take care of herself, much less her 3 children who were all in elementary school. Turns out she had a massive stroke. She was HIV positive and had been on HIV retroviral therapy. So one of the complications of both HIV infection and being on HIV antiretroviral drugs is you're at an increased risk for developing blood clots. And as a result of increased blood clots, if you know anything about strokes, you're at increased risk of strokes. So the point of this is that young people or old people with an HIV diagnosis are at higher risk of having significant disabling illnesses that may not kill them, but make it such that they're horribly dependent. And I think I was really touched by the young woman who had school-age children. I'm just sitting there looking at her and I'm like, she's never going to be able to go home. She's never going to be able to take care of her children. So getting screened for HIV along with hepatitis, and we'll get into that a little bit later, is important because the women, the African-American women that kind of like hold our families together, whether they're our grandmothers or our mothers, are being taken away from us and taken away from their very vital roles of nurturing and supporting the family.
Thank you for that, Dr. Parker. And also noting, of course, that African-American women, I believe at this point, are 8 times as likely to be diagnosed with HIV as white women. While we're glad to see there being some decreases in new diagnoses, the disparity in the rate of HIV in our communities is still just unconscionable. Dr. Alopre, why is this conversation important? And please tell us about yourself.
So good morning. So I am an infectious diseases physician at University of Alabama at Birmingham, and I primarily provide HIV care and as well PrEP care, which is HIV pre-exposure prophylaxis. Since we're sharing stories, I can share the story that really inspired me to move towards a career in research, which was when I was in clinic. I was a fellow for ID at that time, and I was taking care of a young Black woman who was newly diagnosed with HIV. And she came in, it was her first appointment, in tears, crying because someone recognized her in the waiting room. And I tried everything I knew to counsel, talk about the fact that we're happy that she's here, she's newly diagnosed, but we have therapy now that if you take every day, you can have kids, you can live a long, healthy lifestyle. Like, this is something that is manageable as long as we have you in care. And I could not reach her at that moment in time. She left, ran out of the office in tears. And I didn't see her again for another year. And that's really what inspired me, number one, to have research that focused on stigma, because I realized that with every conversation I have with someone who's newly diagnosed, that first conversation is always around trauma and stigma with that diagnosis, the shame that you feel that you were diagnosed, and me trying to help you through that journey of understanding that this isn't something that you did wrong. This is something that happened. It's part of your new life story, and we're going to get you through. And then the other aspect is trying to make it so that we don't have to have these conversations. So focusing on prevention. So a lot of my research focuses on hopefully not having Black people, Black women, Black men coming in and unfortunately facing these inequities when it comes to HIV diagnoses. So I'm really happy to be here. I'm happy that it's in this platform. I'm happy to be on a panel with other Black women. Looking forward to getting into it.
Thank you so much. Minister Becton Odom.
Good morning, ladies. How are you? I'm happy to be here today, and I thank the Links Up Incorporated and my good friend, Dr. Chanel McGoy, for always inviting me and thinking about me, because this is so important to me as an African-American woman that has been living with HIV for 25 years this year. And God has been so good to me. And I am here to show that there is life on the other side of this. Okay. It doesn't have to be a person that falls short and with disabilities and all. I don't have anything going on different than taking my one pill a day. That's it. I have a beautiful son that I birthed is 8 years old. I have a handsome husband that loves me and everything about me. So I stress to all the young ladies that I have mentored, don't let this be the end of life for you, because it's important that you live your life beyond HIV, because it doesn't define you. You know, don't get me wrong. It was a struggle in the beginning, but when you find yourself and you love yourself enough, you can move on the other side of this and there's victory. So I am so excited about being on this panel today, because I want every young woman that is about to take this journey to understand that there is life on the other side of this, on the other side of HIV, and you don't have to fall in that deep depression. You don't have to fall in that dark place, because you can call on a sister like me to help you come out of that situation, because I've been there and God has given me the strength and the power to help others overcome.
Amen. Thank you so much. We are so glad to have you share so generously of your experience. And as you're talking, what would you say to someone, a woman, particularly a woman who may be in her 40s, 50s, older, who maybe has never had an HIV test, who's scared to get an HIV test? What would you offer her as an encouragement or motivation for her to get that test?
I'm glad you said that, Daphne, because I have some friends that are scared HIV test. And I told them, it's just like you going to get your blood tested for anything else that the doctor, in your 40s, we all going through some hormonal stuff. I don't know about you guys, but I know me, menopause is knocking on my door saying, hey, so I'm having all these tests done. I said, we go to the doctor and have all these other tests done that the doctor tell us to. What's the difference with doing HIV? You're doing a COVID test now. What's the difference? So you want to know now if you're HIV positive so you can get ahead of it and get on the medication that, to help you live a long, healthy life. So that's what I would tell them.
Thank you. Dr. Parker, we know that your experience, you've done a lot of work around health, specifically as it comes to aging. So what would you offer for those who are saying, well, I think I'm feeling a little off, but it's just because I'm getting a little older. I don't really need an HIV test. HIV doesn't even come to mind. So how do you go about having those conversations and encouraging people to consider their sexual health and the potential around HIV as they're considering just all of the things that come with aging in our health and wellness?
I think consistent with what Reverend Becton Odom said is, why not get checked? One of the things that we preach in primary care is primary prevention. You get screened for breast cancer. You get screened for mammogram, cervical cancer. You get screened for all of these things. The United States Preventive Services Task Force recommends that all persons between the ages of 15 and 65 have an HIV test at least once. Let me repeat that. The United States Preventive Services Task Force recommends that all persons between the ages of 15 and 65, they didn't say 15, they didn't say 25, they said 15 to 65, get an HIV test at least once. And if you've been screened at least once and you have no risk factors, you're probably fine. But if you have additional risk factors for contracting this virus, and what are some of those risk factors? They are men who are having sex with men. They are women who are having unprotected sex with multiple partners, people who are working in the commercial sex industry, having contact with unprotected sex with somebody who is likely to have come in contact with or maybe HIV positive. So again, we stress very strongly for all age groups, protective and preventive screening. And just as Reverend Becton Odom says, we do all of this, let's do this. When you are age 65, there are a number of things that we like to advocate that women and men do. And with that comes making sure that you screen for all those things that keep you healthy. Have you had, at the age of 65 at least, Have you had a screening mammogram? Have you had a pap smear? Have you had your prostate checked? If you're a smoker, have you had that CT scan to look for lung cancer? So why is that important? Because people that are HIV positive are at a higher risk of contracting other viruses that make it more likely that you develop cancers. If you're a smoker, you're at risk for lung cancer. But if you're a smoker who is HIV positive, you're at higher risk for developing a more malignant form of lung cancer, and certainly getting to treatment after the point at which most effective therapies would be useful for you. So it's preventing and screening. And I see something in the chat here. HIV testing is rapid, free, and confidential, and where you can get it. He says the health department, and by all means, your primary care doctor can do these tests, but yes, HIV is a sexually transmitted disease, but all public health departments, all doctors' offices make it possible for you to get these kinds of screening examinations along with other things that you do. Prevention and screening is really important to preventing long-term sequelae of disease.
Mm-hmm. Thank you so much. And thank you, Matt, for your comment. We know in Athens, there are a number of organizations in addition to the health department. Reach out to the folks that Live Forward, Foundations for Living. And I know also for the purposes of this program, Jerusalem House in Atlanta is also a partner that's been identified. So community testing is available. To follow up to what Dr. Parker said, Dr. Alopre, I do want to ask, you talked about stigma and stigma as a challenge. And when we know what the recommendations are around that one test at some point in life up to age 65. And we also often hear people say, well, I got a test when I was in my 20s, when I was out there, but now I'm saved and sanctified and married, so I don't need to worry about getting the HIV test. What do we say to those folks who, in some parts of the world, sadly, we've heard it said that marriage is the greatest risk factor, right? This assumption that people make about monogamy. I'm not trying to start no mess. I'm just saying. So what is your response to even thinking about that? And how does stigma play into that? And how do we encourage people to still be proactive around getting tested, even when they may be married or otherwise feel like they're not at risk?
I think that's a great question and comment. So yes, I remember sitting in medical school and they were talking about all these risk factors: diabetes, high blood pressure, stroke. And they were like, Black people are more likely to get stroke. Black people are more likely to get this. And I was like, wow, it's just like, if you're Black, you are just, unfortunately, especially in the South, more likely to get X, Y, and Z. And unfortunately, the same is true for HIV. And that's due for a lot of reasons, mostly because of systemic and systematic racism. Outside of that, we know that if you are Black and living in the South, 50% of new diagnoses occur in the South. We know that most Black women who are diagnosed with HIV, and that's 1 in 5 new diagnoses, do not know or do not feel like they were at risk. So our definition of risk, having more than one sexual partner, having a recent STI diagnosis, I think that we're trying to shift and talk about it from an empowerment standpoint, because we recognize for especially Black communities and Southern Black communities, having sex with one person, sometimes that's the only risk factor that you have, right? Even when we've done studies looking at Black women who come in with an STD and they ask about your sexual partner, they have no idea how many sex partners their sexual partner has, if their sex partners have been diagnosed with an STD. And a lot of times that is their one relationship. So I would add and advocate for the fact that this needs to come from a stance of empowerment. And when you're talking about getting things like HIV testing and taking care of your body, that includes taking care of your sexual health. So if you're 20 and you got tested, that's great. I would advocate that if you're in a relationship, you're having sex without condoms, and you don't feel like you're confident enough in that relationship to say, hey, babe, when's the last time that you had an HIV test, an STI test? You might want to just go ahead and take it upon yourself to go get tested. And I think that that's kind of what we need to be teaching as providers, our patients. Get tested, empower yourself, advocate for yourself, and take your sexual health into your own hands.
Thank you for that. Minister Becton Odom, you shared about your personal journey with HIV. Would love to hear from you what you share with those you mentor and you talk and that you encourage about disclosure. Because we know that's also a big part of the conversation, that fear of talking with partners, even before you know your HIV status, but if someone learns they're living with HIV, what advice do you give, or what do you share about your own experience?
Okay. My personal journey, well, I would tell them that's a personal journey, first of all, because being able to disclose to somebody is very, very hard. It takes strength, and that strength does not come from you yourself. It has to come from above. It has to come from God. It can't come from, and everybody don't believe in that, but that's what I believe. And so I had to love myself enough in order for me to be strong enough to tell anybody outside of my immediate family. Because when I first found out, my mom and dad were the two that took me to the doctor. I told the doctor it was okay for them to tell my mom first my diagnosis, because I didn't want to know. I wanted to come from my mother and father. So I, not like other people, had the support that some people don't have. So when it was my opportunity to help a young lady in early intervention services, to help them, coach them on how to tell that their family member or the person that they had slept with, you know, that was a very special moment. But like I tell them, you have to love yourself first, because people can reject you or people can love you. It's two things that's going to happen. They're going to reject you or they're going to embrace you. Okay. So you had to be ready for that. So that's the I tell them. And then the second thing, if whatever the outcome be, you have to be strong enough to accept it. Did I answer the whole question?
Yes, thank you. And I think that's a great transition to really talking about the experience of folks who are living with HIV who are aging. 60% now of people who are living with HIV in the United States are over the age of 50. And that number is just going to climb as the science gets better and more folks are engaged and retained in care. We're going to have primarily folks who are older who are the ones living with HIV in this country. And we also know that the data shows us that people over 50 living with HIV are more likely to experience isolation, are more likely to not have a space for disclosure to share their status. So how do we, and this is to any of you all, how do we change the way that even older folks in our community, and I'm getting to the point of elderhood, in my mid 40s, I tell people I'm seasoned, but not salty, right? Like, so we're like getting to this place as we're getting older. How do we have these conversations? How do we create, I think younger people have done a great job of creating spaces where they are embracing one another and encouraging one another and not judging one another when it comes to HIV. How do we do that with our elders and in our aging communities? Yes, Dr. Parker.
I just wanted to follow up. I agree very wholeheartedly with what you're saying. And one of the things that Dr. Alopre said that I really, really applaud is take charge of your own health. So when you're a woman of a certain age, you know, we want to do this, we want to do that, we feel a certain kind of way. But as we get older, particularly with African American women, we're no longer married to somebody. We may be widows at the age of 50. Maybe we're widows at 40. Okay. And then we have to go out here and do stuff all over again. I'm looking at several of my friends who are between 65 and 75, many of whom are still working because they don't want to lose their health benefits. Well, you know, one of the things that helps keep you healthy is taking charge and making sure while you still got that employment and that health insurance that you screen for and look for everything that could possibly go wrong. You know, a very close friend of mine had a brush with ovarian cancer at a late stage. And she has been worried about retiring because she wants to be able to afford her chemotherapy and other things. Well, one of the little dirty things about HIV infection and any other kind of vulnerable disease when you get older is you have to seek treatment somewhere. And unfortunately, you have to have a way to cover that care. So, you know, what is your health insurance benefit? Let's start looking at what our health insurance is, you know, empower ourselves to take care of ourselves. Many of us are going to be widows. Many of us haven't ever gotten married and have no children and have nobody to take care of us. So how are we going to do that? When you're 50, when you're 60, when you're 70, when you're 80, who's going to be taking care of you if you have no husband and you have no children? So screening for HIV infection, not only with HIV, I go into this whole preventive care thing, but hepatitis goes along with HIV. My daytime job is dementia. So depression goes along with dementia and neurocognitive or memory dysfunction. You got to check yourself for all of it. And instead of thinking, oh, this is a disease, it's like, I got to be able to take care of me. So I'm all on the empower myself to take care of myself. That's not just screening for healthcare, but looking into your financial resources as to how you want to take care of yourself. What kind of retirement plan have you made, not only for your overall day-to-day maintenance, but healthcare is a lifelong kind of thing. How are you going to cover that? And unfortunately, in communities of color, most healthcare providers, I didn't say systems, don't particularly care to take care of people who have Medicaid as their only pay source for getting medical care. It's a nasty, dirty secret, but we want Medicaid expansion, but Medicaid doesn't pay anything. That's why doctors don't want to see people who have Medicaid. If they're dual eligible with Medicare and Medicaid, they'll see you in a governmental setting, but in their private practices, they don't have to see you. They limit the number of people that have that kind of coverage. That's all I have to say.
I want to add, one of the things that I think always comes to my mind is like the Time magazine photo with the handful of pills. And that's, I think, what we associate with HIV, that handful of pills and AIDS and death. And that is not the case. So I liked when you brought up your 1 pill a day, Reverend Becton, because that's really what it can be. It's 1 pill a day. It's a very tiny pill. I'm always very proud of how far we've gone, just with what we're able to offer people, very few side effects. And the fact that if we educate, especially Black communities, about the fact that if you are living with HIV and you are undetectable, meaning we don't see any virus in your blood, you cannot transmit the virus. Your life expectancy is the same as someone who does not have HIV. And this is something that really becomes a chronic illness, which is why we are specifically talking about it among people who are 50 and older, right? Because that's who we're seeing now. That's who we're having to learn how to make sure we're taking care of appropriately and doing all the preventative measures that Dr. Parker is talking about for our aging population living with HIV. So I think that if we continue to educate Black communities about the fact that this is now really essentially can be a chronic illness, and that it's something I think that's liberating, that if you have HIV and you're undetectable, you can't transmit the virus, I think it's huge. And hopefully it can be a game changer if the word continues to get out and people won't have to live in isolation.
Just add that to your diabetes and your high blood pressure pill. Just one more.
And I want to say that I have I ain't gonna say a whole bunch, but I at least have 5 single friends. And the oldest one is 54. And she, y'all, is doing whatever. I think she thinks because she sees the outer part of me that I'm healthy, I'm this person, but she still forgets that I'm your friend that's been your friend over 20 years, and I take medicine to live. And it's a medicine that I have to take. It's not something that I take that I must take every day. But she still lives her life as, oh, I'm single, I'm out to mingle. And then I have to stop her. I said, look, now, there's something out there that wants to attach itself to your blood and your T cells and all. And you're a nurse. Okay? Can't call no names, won't call no names. But I'm just saying, sometimes you have to tell your friends, sit down and let me have a conversation with you, because it's real. Just because I take my medicine every day don't mean that HIV is not going to affect you the same way it affects me. Your body is totally different. Your body's set up totally different than mine. So, I find myself having conversations with my friends, and I'll be like, come here, little girl, sit down. Let me have a conversation, because right now you're acting like a child. So it's unfortunate, but I suggest that, we have these small conversations with our, group of friends that are doing things that they should not be doing, so they can have a reality check.
Thank you so much for that. That's a perfect transition to what I wanted us to talk about next. Since we're talking about empowerment, and we're not shaming anybody, right? Be sex positive, sis. Do your thing. Take precaution. So let's talk about PrEP. Let's talk about pre-exposure prophylaxis. And I'm gonna turn to Dr. Lopre because I know she loves to talk about PrEP. But we know that, PrEP or pre-exposure prophylaxis is a medical regimen. It's a pill that someone can take every day to prevent becoming HIV positive. And we do not see it being utilized a lot among Black women. And there's a number of reasons for that. But I would love to hear from you, Dr. Lopre. I mean, folks over 50 are definitely engaging in sex. And we're not even going to talk about the advent of the little blue pill and what that's done in a lot of our retirement communities, HIV and STIs, all of the things. But tell us a little bit about what the options are for folks who are watching who may not know all the prevention opportunities that are available to them and how they can access them and what some of the challenges are.
No, I do. I love PrEP. So, and the reason I love PrEP is because I said, stigma is so huge when it comes to HIV, and we have an option now where if you take a pill a day, for a woman especially, take a pill a day, you essentially, if you're exposed to HIV, will not get HIV with PrEP. So that's one prevention option. I always like to promote condom use. We don't talk about condoms, but I will say that, especially for our aging population, most do not wear condoms. And we know that, and literature and data support that. So if you're sexually active, you are having sex with one person not wearing a condom, and you don't know whether they are living with HIV, whether they've had recent STIs, PrEP is an option for you. And I think that the issue is most people, especially Black women, do not think PrEP is an option for them. They've seen Gilead commercials, which is right now the only drug that's approved for PrEP. And they see gay men on the commercial. And that is a population that I'm very passionate about, and I think also needs a lot of advocacy. But PrEP is for everybody. If you're sexually active, PrEP can be for you. And the great thing that I'm also excited about is right now we only have this one option, but we're going to have a lot more coming down the pike. So options where you can get a shot that covers you for a month, 2 months, that covers you if you're exposed to HIV, you will not get HIV. Implant devices, vaginal rings, and they're looking at even dual birth control options where you can take a birth control pill that has PrEP in it. So I'm excited where HIV prevention is going. And I think that in order for us to get ahead of this and make sure that Black women specifically know that this is an option for them, is we have to start talking about sex in open spaces and talking about what it means to be an advocate for yourself and be sexually healthy. So I think PrEP is a part of being sexually healthy.
So can you tell us, Dr. Lopre, talk a little bit about how someone even gets on PrEP? Like, what does that look like? And then what does the regimen look like? Do I have to take it every day forever? How does this work?
So my goal and what I try to do is have it where you don't have to come see someone like me to go get PrEP, because I am in an HIV clinic, and a lot of people feel like there's a lot of stigma walking into my door. I want it where you can see your primary care provider, your family practitioner, your adolescent provider, and get access to PrEP. So right now we are dealing, because providers are human beings, with stigma on the provider side. So again, advocate for yourself. If you think PrEP is an option for you, go to your doctor and say, tell me about PrEP. Are you currently offering it? The other way you can look up who's offering PrEP is to go to sites like prepme.org, where you can find PrEP providers within your area that are prescribing PrEP. So in order to get on PrEP, they do an HIV test. We test for hepatitis B. We do STI testing, and we check your kidney function. The other option and thing that we always look at is if you are an older adult and you have any issues with bone health, PrEP may not be available and an option for you. So we check all of these things. And then if everything looks good, your kidneys are functioning normal, you don't have HIV, we start you on PrEP. And you come in typically every 3 to 6 months, and you come in to see us. We do HIV tests to make sure you're still effectively protected by PrEP. We're making sure that you're not having any barriers to adhering to PrEP. And we give you your 3-month prescription. So I think it's actually an easy thing to get into care for if we had more providers offering it and more people were aware. So I'm very much so an advocate for PrEP. I think it's a part of that sexual health toolkit.
Thank you. And that takes us back to that theme of empowerment and having the knowledge when you're going in to talk with your providers. Dr. Parker, did you want to jump in? Thought I saw your hand go up.
Yeah, I just wanted, and I did put this in the chat, when we're talking about availability and other things, but when should we consider taking PrEP? You know, we're women of the world and all that kind of stuff, but when do we consider it? You know, my explanation or introduction to PrEP was as it related to adolescents who were considering sexual relationships. Young boys having sexual relationships, because there's a lot of HIV research on those people who are youngsters having sex. What about middle-aged women like myself? When do I consider and how do I consider taking PrEP? How do I know I'm at risk? If I'm single and wanting to mingle at 55, 65, whatever, do I ask my partner, has he had an HIV test, or do I go to my doctor and just get a PrEP and just do it?
I think so. That's a great question. And that's something that we are still making sure that we are advocating for and talking to our patients about. So PrEP is not something that's a long-term medication. You don't have to be on PrEP for the rest of your life. But I advocate for the fact that if you're in a relationship, especially if you're in a relationship where you're experiencing intimate partner violence, and that's not just physical violence, but emotional violence, you're feeling like you're in a coercive relationship, you're in a relationship where you can't have open conversations about sex and sexual health, PrEP, I think actually is a good option for you. We know that most women living with HIV, up to 2/3, report that they've been victims of intimate partner violence. That is a predictor in and of itself of, unfortunately, being diagnosed with HIV. The other thing I would advocate for, that if you are single and you're ready to mingle and you're out having fun, being sex positive and not always wearing condoms, PrEP is an option for you. Once you decide to engage in a monogamous relationship, I always tell people, once you're saying, I want to be with you, you should be in a relationship where you can say, I want to be with you, but I want to see your HIV test results. I want to see your STI test results, and you can see mine, right? And so I think those are all the seasons in a woman's life where PrEP may be an option, and not just when we're talking to adolescent populations specifically, because that is who we worry about. That is population that I think right now sometimes is at highest risk for HIV just based off numbers. But ultimately, like we were talking about earlier, for Black women, most don't feel like they're at risk. And we're seeing 1 in 6 individuals 50 and older being diagnosed with HIV. So it's still a real thing, even as we get older in life.
So if someone gets on PrEP, does that protect them from all STIs, or is it just HIV?
It is just HIV. You still have to wear a condom, some kind of barrier protection to protect you against gonorrhea, chlamydia, syphilis, trich, and herpes. All of those things can still be transmitted.
Yes. Want to make sure we're crystal clear on that, so thank you so much. And also want to give a shout out to PEP, or post-exposure prophylaxis, which folks we call it the morning after pill for HIV. So if you have engaged in sex where you feel like you could have been a risk for HIV, or you did not know the status of your partner, then that is an immediate thing you would need to do. Is it within 72 hours? I'm kind of within 72 hours of potential exposure, getting the pill for post-exposure prophylaxis. So it's something else to keep in mind, or to put in your toolbox as you're kind of thinking about ways to protect yourself. So I know we are winding down on time, and we have probably about 5 or 6 minutes left. So definitely want to provide some space. We're just talking about, I'm glad we've had this conversation around stigma and prevention and disclosure. And so want to provide some space, Minister Becton Odom, for you to share more of your story, because it's so inspiring. And we're seeing in the comments that folks are loving hearing from you. But you mentioned the fact that you've been living with HIV, living and thriving with HIV for 25 years, and you have an 8-year-old.
I have an 8-year-old. Yes.
There are so, please share your story.
Well, I was single for many years. Let's start there. And I prayed for a husband, and I decided to be celibate And I was celibate for 5 years and 11 months when I met my husband. So the first time we had sex, I got pregnant. So, and I was really afraid because I was like, I don't know. But my husband is just the most generous person. And he said, I understand the risk, but I'm willing to take that risk with you. We've already talked to your doctor. You're undetectable. The exposure is limited. He's just the most understanding man. And I thank God for him. But anyway, we had Bryson. He's 8 years old. He's not positive. He's been tested. He was tested up until he was 4 years old. I actually let him do the research at St. Jude because I thought it was important that they follow him for the years that we were there in Memphis, but we're not there anymore. So he wasn't able to continue it up until his teenage years. But I'm so grateful to God for just being able to see what living with HIV, it doesn't have to stop your whole life. I'm able to raise a child, and I had him vaginally. I did everything that I need to do to have him vaginally. First of all, being undetectable, being on my medication. Because when I was in my 20s, when I first got diagnosed, I wasn't trying to take no medicine. I was in denial, honey. That's aging with HIV. That's a lot. It's saying something within itself. You have to mature as you grow in HIV. You have to have some strength. You have to have some support. You have to have peace about yourself, so you can age gracefully, because it's just not about taking the medication. You have to be strong. You have to be mentally strong in order to walk in this journey. But I encourage the women that I mentor, don't stop right there. If you want a family, pray for it. If you want to have a baby, you can do it. You can do all things through Christ Jesus who strengthens you. It's available to you, but you have to do the necessary things in order to get there. A little bit about my story. I was contracted with HIV through a family friend to my brother. Nobody knew but my parents after I got tested. I didn't tell anybody about that. Fast forward, I was on a medication once, Viramune, broke me out. I almost died. I know I'm skipping around, but I just want to tell some tidbits about. I almost died from Viramune. Took my hair out, took my toenails out, took my fingernails off. I had Steven Johnson syndrome. Okay, tore me up. But God, he put me back together piece by piece, not only on the outside, but it took him to put me together on the inside, So it's not always peaches and cream, but you can live, like I said, on the other side of this. If you build your strength, put your faith in God, and trust that everything is going to be okay. I have a flourishing life now. I mean, you could not have told in 1996 when I was diagnosed that I would be okay. I lost you for a minute, but you could have not told me that I would be living the life that I'm living right now, and I'm so grateful. So my goal is to help any individual, white, black, Asian, female, male, boy, girl, to help them live on the other side of this to the best way possible. So that's tidbits of my story. I know we're running out of time. I know I skipped around, but I just wanted to share as much as I could during this time that was allowed.
You are an inspiration. Thank you so much for sharing. Just that little tidbit gave me chills. And I know there's so much more to your story. And I hope you're working on that book.
Girl, can you help me? I need somebody to help me. And I promise you I got it down, but I need some help. I know somebody.
That story is one to be told. We do only have a few minutes left, so I'd love to, Dr. Parker spoke earlier just about the role that Black women particularly play around taking care of everybody else and having to take care of ourselves. So I would love for us, each of you, to share, one of the challenges we have. I'll use an I statement. I struggle with my own self-worth at times. And for a lot of us, that is what we struggle with. It's like, am I worthy of taking the time to make sure that I have everything I need? Am I worthy of challenging my medical provider when they're not even willing to really engage in this conversation? And seeing our worthiness is self-care, seeing and understanding, acknowledging our self-worth. So what tip would you give to women who are aging, women who are 50 plus, who maybe have to reprogram themselves to see themselves as worthy? How do we age gracefully? How do we take care of ourselves when it comes to HIV prevention or HIV care or health in general? So I'll start with you, Dr. Parker, if that's okay.
Well, I think I'm going to stay on the page that says we need to empower ourselves. It comes in all different ways. Those of us that are in my age group, many of us are dual caregivers. We're taking care of children. We may be grandparents who have to raise our grandchildren, and we have to take care of our aging parents. And as somebody who's in some of that role right now, I'm like, so who's going to be here to take care of me? Who's going to be here to take care of me? Who's taking care of me? Well, it's my girlfriends who are taking care of me. And I have a number of really good friends around the country who call me, who pray for me, who do all kinds of things. But my responsibility to myself, to my family, to my friends is to put myself in a position to take care of all the stuff that I need to do. And consistent with what Dr. Alopri says, with what Reverend Becton Odom says, you do have to take care of yourself. I'm not going to use any hokey cliches. I'm just going to send you all. I want you to get to the U.S. Preventive Services Task Force, look up your age group and see what it is that you should be doing to take care of yourself. Okay, if you're 65 years of age and older, I'm going to send you to the CMS Medicare page to look at annual wellness visits. All of the screening exams, courtesy of that fine man called Barack Obama, are now free and covered by your insurance. Get your mammogram, get your your pap smear, get your colonoscopy, get your eyes checked, get your hearing checked, get your vaccinations. We're dealing with COVID right now. People who are at risk, have immune compromise, are at risk of getting COVID, but they're also at risk of getting all other viruses, flu as well. And if you're HIV positive, all of those things are additive to making it more likely that you suffer more from having whatever the disease process is. So look up wellness, look up whatever it is for your age group that you are required to do. And because of this discussion, because we're having this discussion about HIV age, 15 to 65, you have to have at least one HIV test. And with that HIV test, you should be getting checked for hepatitis as well, because they kind of go together. A lot of liver cancer is HIV. Just saying. I mean, I've learned that it's like, oh, they've got liver cancer. It's like, and they've got hepatitis. They've had untreated hepatitis C. And then, oh, by the way, we did all this test and they actually are HIV positive, Dr. Parker. So I'm like, get it all done. Look up wellness for your age group. Look at what your insurance covers. Find out what you need to do to take care of yourself first. And don't be crying and making yourself a burden to all your friends.
She speaks the hard truth. Thank you, Dr. Parker. Absolutely. Absolutely. Dr. Alopre.
No, I like what you were saying about friends, especially Dr. Parker. I think, using I statements, I personally struggle with putting myself last. I think as Black women, typically we are caregivers. We put our kids' health first, our husband's health first. I made sure my husband got on a statin. I was like, we need to get your lipids checked. And I hadn't been to see a doctor in over 5 years. So I think that one of my friends sat me down and said, talk to yourself the way you would talk to me. Give yourself the advice that you give to me. And that's how you should take care of yourself. That's how you need to do self-care and advocate for yourself. So I think as Black women, we need to talk to ourselves the way we would talk to our friends, and love ourselves the way we love our friends. Because if we don't have us here, I agree, who's going to take care of people? Who's going to take care of our babies better than we do? So that's what I would lead with.
That's great advice. Minister Beckton Odom would love to give you the last word. What is that one nugget that you want to leave today?
Well, I think that kind of summed it up, because I was going to talk about love. But yeah, loving yourself is important. I think, like she said, we as Black women, we always put ourselves in the back. Like for me, I'm always putting Bryson first. I'm putting Alan first. But I did get that colonoscopy, Dr. Parker, 2 days ago. So I just think that's important. We have to love ourselves enough to get all the screenings we need done, to take care of ourselves, because if we don't take care of ourselves, we can't take care of other people. I can't take care of Bryson. I can't take care of my son if I don't check on myself first. Self-check. That's what we need to do. Self-check.
Thank you all so much. And thank you all for joining us. This has been a rich conversation. And we hope that you will learn your HIV status if you don't know it already. If you do know your status and you're living with HIV, get the care and resources and support you need. There are resources in your community. Look into CMS. PrEP is now also covered, and you could likely get it at zero cost. So please, as you're checking for all the different annual screenings you should be getting, if you're interested in PrEP as an option, there's lots of information and lots of resources in our communities for that as well. We'd like to now turn it back over to Shanna Jackson Sheets, president of the Athens chapter of the Links Incorporated. And on behalf of all of our panelists here, thank you so much for taking time to share with us today. And go tell somebody something you learned during this panel. Thank you.
Wow, what an outstanding and amazing real life, open and honest conversation surrounding HIV and aging. We hope that this forum has been both informative and empowering. The Athens, Georgia chapter of the Links Incorporated would like to extend a special thank you to all that were involved. Thank you to our host for today, our Southern AIDS Coalition, to all of our panelists. Thank you for your knowledge, for educating us, and for your personal stories that you shared with us today as well. We would also like to say thank you to the Links Foundation and to Gilead Sciences as well. Thank you to the Buckhead Cascade chapter of the Athens, Georgia chapter of the Links. We also hope that in the future you will join the Athens, Georgia chapter of the Links Incorporated for future discussions surrounding HIV awareness and education. So stay tuned in the very near future. As we close, our prayer is for you to stay healthy, stay safe, and to stay well. Goodbye.